Hi, I'm Jason. I'm CEO and co-founder here at Gigasheet, and today we're going to talk about transparency and coverage data. Gigasheet is a big data analytics platform that makes data easy to work with of any size. And one of the things Gigasheet's really good at is working with MRF data and price transparency data. And today we're going to show you how we're working to simplify that. These files are huge, and in general, they're very messy. And what Gigasheet does is we've built infrastructure that allows us to source these MRFs, these machine-readable files, extract the data automatically, flatten it to a spreadsheet-like interface. We do a lot of cleansing and enrichment as part of our pipeline to deduplicate rates, add NPI and taxonomy information, remove irrelevant zombie rates, and even enrich it with Medicare reimbursement data. We can enrich it at this step with any number of different sources, whether it's location-based information or sales contact information like B2B sales intelligence, and more. And then we deliver the data for analysis in our interactive spreadsheet-like interface, which we're going to dive into right now. So today we're going to do a simple maybe investigation of a high dollar claim or maybe something that just kind of raised a red flag, and I'll show you how you can look at price transparency data. Now, full disclosure, I'm not an expert in healthcare, but I do have Google and I have Gigasheet and a lot of data. So let's dive in. Okay, so here we are in Gigasheet in the library, which is kind of like where you keep your files or database connected views here. And you can see we have some MRF files from Jackson Health in Florida that we've already loaded here. But let's flip over and take a look at this national data for Aetna. So this is nationwide information that Gigasheet has processed for Aetna MRFs. This was billions of rows of data originally, and then we've pared it down to about 7.5 million rows of data for high cost related claims. And if we group on one of these columns, I'll just use description here, you can kind of get an overview of what's in this file here. In this case, I'm really interested in investigating a claim for a total knee, which is this CPT code here. So let's actually filter to that. So I'll right click, say filter to this. I can remove my grouping now, and now we can see data related to it. So let's just take a look at what columns are available in this file. We've got name of the procedure, billing code, description, and so forth. You can also see that we've included some rate information like the non-facility rate from Medicare, as well as service codes. This makes a difference as well. There are modifiers also, which we may want to keep an eye on. So you can see this looks suspiciously low here, but probably has to do with this particular modifier. So we could right click and filter to exclude that and start to clean up some of this data. So we can see the non-facility rate here. And again, this is nationwide, so it's adjusted regionally. Practitioners in different areas may have different negotiated rates. And you can keep up with our filters in this panel. So so far we've filtered to this CPT code, and we've excluded the 30 modifier. There are a lot of columns in this file. There are 72 different columns, and you can see that we've pulled in lots of provider information from the NPI registry. So if we scroll to the right, we can see some of these additional columns that we've got in this file, including the provider names, addresses, and other information like their location. So let's continue with our analysis here. In this example, we're going to say we're looking at a total knee in the Florida area. So in this case, Miami. Let's filter to practices with a practice location in Florida. And in this case, I will zoom directly into Miami. but we could zoom out or look at other regions as well. Also include Miami Beach. So now I've filtered this 7.5 million rows of data down to 1,400 records now that we're looking at this. But as I look across here, I can see there's some fee schedules. In this case, what I really want to look at are negotiated rates. So we'll exclude fee schedule and percentage just for this investigation. I also want to focus on just professional rates here. So I will exclude institutional at this point. Now I can see that I've got negotiated rates that are professionals, and I've got my modifiers here as well. So I could filter those further if I need to, but now I'm starting to see some information here. And let's sort in descending order based on the negotiated rate. So here, if we pull over the non-facility fee schedule and the negotiated rate, I can see there's a pretty wide difference actually. And if I use this aggregation, I could see what the range of values is here. So there's a $5,500 range in these particular negotiated rates. And if I want to see kind of who's at the top, like these 3 or 4, I can scroll over to the provider details and see exactly who's getting these rates and their location. Next, what I want to do is actually make sure these are all orthopedists. MRF files are notorious for including information about rates for practitioners who aren't associated with those procedures. So here you can see we've included a column here with taxonomy codes from the NPI registry. Let's just take a look at these, what we've got in here. So these are all this particular code. And if I go to Google, I can see that's orthopedic surgery. That's good. That makes sense. MRF files are notorious for including irrelevant rates, and I can see here that we've filtered it just down to taxonomy of orthopedists, which is perfect. So now I have a pretty good sense of what rates are in Miami for Aetna and the range of rates that are available. The next thing I probably would want to do is also look at billing code modifiers just to make sure that we're comparing apples to apples. And I could even filter on further the place of service code, for example. Like if I just wanted to look at ambulatory care, let's just see how many unique codes there are. In this case, they're all the same. So I actually don't need to group on that. So all of these negotiated rates are for the same place of service. There are some different modifiers that can be added, but if we want to look at it with no modifiers, just the straight negotiated rate, we can see here, this is the Medicare rate, and then we've got the rate for that's been negotiated with the provider directly. One thing, we are filtered just to negotiated, so it's good to just double check we're not including fee schedule or percentage. That can often throw off the numbers. And now we can see here, we can calculate like averages, for example, and also look at max rates as well across these. So if I was investigating a claim, I could use this information to start to get a sense for kind of who's getting paid what a typical rate is from Aetna, and where these people are located exactly. And of course, I could change any of these filters at any time. So if I wanted to just look across, say, all of Florida, I could do that. I could do it by zip code even. All the data's in here, and you can explore it. The next step of this might be to look at hospital data. In this case, I've got data pulled in for the Jackson Health System in Florida. Pulled each of these MRF files individually. They're just large CSVs, but they are quite large. These are too big to open in Excel, which you could look at CSV files up to about just over 1 million rows if you have a powerful machine. But what I've done is I've taken these CSVs and I used our combine files feature and created this new file called Jackson Health Standard Charges all locations. So now I can compare all of these locations together at Jackson Health and see what they're charging. So I could do this for all hospital systems in Florida as well. You can see we've got the data here for each of these, and you can combine. These could all be combined together, assuming the columns line up and they have similar data. Some hospitals are following the schema better than others. So for this case, I'm just looking at the Jackson Health all locations. You can see once we've combined it, it's about 17.5 million rows. So this is what the data looks like. Columns are slightly different in this file. You can see we've got a source column, which I added, where if we group on this, we can see, okay, we've got records for each of these different locations, and we've got various codes. Now, this file does not include CPT codes. It includes CDM, which I have learned is their charge master rate, which is an internal code, I guess they use, and then their, or rather, sorry, their, I believe this is their internal code, the RC code, which is, I think, a revenue code. And then they do have HCPS codes here. They've told us whether it's inpatient or outpatient. You have the standard gross charges. Sometimes they offer cash discounts, any modifiers as well. And then here we have payer names and plan names. So we could group these by payer, and then within that, group by plan or filter to plan. There's also some notes here about the methodology that's been used in this case, as well as a minimum and maximum charge. So because this doesn't have CPT codes and I'm investigating this total knee, I started to just do some research on Google and honestly just came in here and said, well, let's start by just looking at any orthopedic, anywhere where it contains orthopedic. And we can see here this particular description. And when I did some research on this revenue code, here, yeah, for surgical supplies and implants. So this makes sense, more or less, that it would be associated with that. What I'll do is group on this and see if there are different codes that they use. Instead of row count, I want to see how many unique there are. So they all have the same description. And let's actually group this by source. So now what I could do is look across each of these hospitals and say, like, what's their average standard gross charge on all of these? And super interesting that this particular location seems to be less. We'd want to drill into these codes here, obviously, and make sure that we're looking at the appropriate one. But if you're interested in learning more about Gigasheet for price transparency, drop us a line at sales@gigasheet.com. Thanks for watching.